I think the main things you're going to get are coughing, wheezing, increased mucus production, pneumonia, and then, because you cough, a certain subset of population are at increased risk for these things called spontaneous pneumothoraces, or that's a collapsed lung. And you're at very high risk for that in that population, which is usually younger, tall, and lean individuals.
Rice says the liquid within a vape is not regulated, so the extent of all the chemicals within them and the harm they can do are unknown.
You are introducing one particulate matter into your lungs, which is never a good thing, especially because as these things go to distal parts of your airway and they're irritants in your airway, they can cause long-term effects from local inflammation, right? And it's mainly the chemicals that are inside of the vape liquid. And like I said, there's thousands of chemicals that are in these things, especially when it comes to the flavored vapes. They get the flavor anyway. They try to absorb the flavor into the liquid itself. And so you end up with, metals, formaldehyde, diacetyl, all these chemicals that you really shouldn't inhale.
Common populations at risk for vaping are teenagers and young adults.
These are people who have never been exposed to traditional cigarette smoke, and they're more likely to vape than older populations. I think the thought process is you don't get the after smell that you did with traditional cigarette smoke. So you could vape and nobody would ever know it because your clothes don't smell like smoke. It's a tough topic, and I think we're just in its infancy. The prevalence of vaping, I think, is going to get much worse before it gets much better. And I think until some of the long-term effects come out, we are kind of stuck in this like, hey, we shouldn't do this, but there's no hard evidence that this is really terrible for you long term. But the common knowledge of what cigarette smoke did to people's lungs should foreshadow what's going to happen to you.